This skill is emptying the catheter drainage bag with PPE, and this skill is also a measurement, a documentation skill, and an evaluated hand washing skill. Because it's an isolation room, my supplies are going to be outside the room for me to get started. So I'm going to start by sanitizing until dry. I'm going to don my PPE by starting with my gown, and I'm going to get the gown opened up and put it on. The purpose is to cover all surfaces. So I'm going to start by tying at the neck first. Then I want to make sure that my gown is covered in the back. So I'm going to overlap the gown, and I'm going to tie at the waist. And I'm going to put my PPE gloves on over my gown, tucking it in so there's no skin showing. The supplies that I'm going to bring in are 2 barriers and alcohol swabs. And because I'm going into an isolation room, it's going to look a little different from some of our skills, but I am still gonna knock and get permission to enter. Can I come in? Cindy, I'm Sue, your nurse aide today. I'm gonna empty your catheter drainage bag. Is that okay? And she says yes, so I'm going to pull the curtain for privacy. I'm going to confirm that the brake is on. And I want to make sure that I'm going to be checking for 4 things regarding her catheter. I would normally not expose my resident, but for demonstration purposes, I'm going to show you that the catheter is checked at the meatus and that it is intact. It's over the leg, there's no leaking, it's in a coiled position, and it's attached to the bed frame. These checks are ones we will do again before I leave. I want to identify that in an isolation room, she already has her call light in her hand, and I'm making sure that the bed is in a locked and a low position, so that all of this has been taken care of before my hands get contaminated with emptying the drainage bag. So now I can set my barriers down. I've got one with the alcohol swabs where I'm going to empty, and the other one is going to be placed where I'm going to measure. This is where I can open and find her graduated cylinder. I'm going to reach to hold the bottom only. I'm going to put it in position, but I have to do one more thing because we're looking at total output. That means I want to get the urine that could be in the tubing. So I'm never going to raise it above her bladder. I'm going to come low and let gravity bring it down. And then I'm going to raise this part up so it drains into the bag, and I'm going to replace this to a coiled position. At this point, I'm double checking that it's still intact over the leg in a coiled position and on the bed frame. Going to cover her up for privacy. I have the end I'm taking out of the housing, and I'm going to open to empty the bag. And you're going to empty all the urine each shift. This is where, with friction, I'm going to wipe, make sure it's closed before I return it to the housing on the bag. At this point, I'm going to take my dirties, my barriers and my alcohol swabs that have been used, throw them away. I'm already starting to assess the urine. I can smell the urine, but I'm not going to measure it until I set it on the barrier, get down at eye level, and identify that it is at 350 cc's or mLs. I have plus or minus 25 cc's, and I'm going to assess the color, if there's anything floating, any sediment, and I have the amount. So I can get rid of my barrier, pour the urine into the toilet or commode, and I'm going to rinse, put some soap in. Everything goes into the toilet. Once I have rinsed it out completely, I'm going to dry it, always holding it at the bottom, and I'm going to return it to the bedside stand. At this point, I'm really done with the skill, and I'm going to remove the privacy curtain, ask her to use her call light to let me know if there's anything else she needs, but I'm going to be leaving the room to take off my PPE. I'm going to take the gloves off first, removing by dirty to dirty and clean to clean. I'm going to start removing my gown by taking the waist first and then the neck. Now I want to keep my clean to clean, so I'm going to the inside of the gown, turning it completely inside out and controlling all of what is on the gown by rolling everything to the center, and then I can throw that away. Now I'm going to come to do my evaluated hand wash. So I'm going to use a barrier to turn the water on. I'm going to hold on to the barrier until I'm sure about the water temperature. So I'm going to get both hands wet with fingers open and aim down to the bottom of the sink. I'm not going to flick, I'm just going to let things drip. Get soap on both hands, go right to the wrist, do the backs of the hands, the palm sides of both hands, individual fingers. Then I'm going to work on my cuticles. After the cuticles, I'm going to scratch each palm and then do underneath the nails. And I'm going to rinse from top to bottom, rotating making sure I get all the soap off. Fingers open. And I'm going to dry from fingertips to the top. With a padding from fingertips to top. Starting at the fingertips with a padding motion, fingertips to the top. And done. I need a barrier to close the faucet and throw that away. Now that my hands are clean, I'm going to document by signing the 350 ml output. The urine was medium yellow, normal smell, and it was no sediment. So I've completed my evaluated hand wash. I've taken care of my PPE. I have the measurement of the urine, and I'm going to end by sanitizing until dry, assessing that I've completed the skill appropriately, and say, I'm done.